Cough. Cough is an automatic reflex muscle action that forces air up and out of your lower airway and upper airways. Everyone coughs occasionally to clear their throat. The cough reflex protects the airways and lungs. Coughing occurs if the airways are partially blocked by mucus. It also occurs when choking one bit of the food which enters the windpipe instead of going down the food pipe. People may need to cough if they breathe in chemicals or smoke that irritate the airways. So, the cough can be divided into three: acute, which means it lasts for less than 3 weeks; subacute, which means lasts for 3 to 8 weeks; and chronic cough longer than 8 weeks. Acute cough usually improves after 1 week, although often lasts up to 3. The most common cause is the viral infection, which causes a runny nose and cough. Common cause of moreover, I would like to mention a common cause of the acute cough. It can be divided into upper airway respiratory tract infection, lower respiratory tract infection, and asthma. The asthma can present with a wheeze, breathlessness, and cough, which tend to be worse at the night, and which is aggravated by cold air and during exercise. An infection with virus can make the symptoms of asthma much worse. This is called an exacerbation of asthma. I would like to also mention a common cause of the subacute cough, which have the whooping cough and tuberculosis. And then, cause of the chronic cough. It includes the postnasal drips, which means this is a condition where mucus in the nose drips down the back of the throat. It can be caused by an antigen, which causes the nose to produce more mucus, caused by an allergy, hay fever, and nasal polyps. And then the acid reflux. Acid in the stomach wash up the windpipe and spills into the airways. Asthmas. And many drugs can cause the chronic cough, like some antihypertensive like the angiotensin-converting enzyme inhibitor, which are used to treat the high blood pressure, and lung disease caused by smoking, such as the COPD, and irritants. The other cause of the cough include lung cancer, cystic fibrosis, and pneumothorax, bronchiectasis.